I am delighted to welcome Berwood Yost, Director of the Franklin and Marshall Center for Opinion Research, to the stage. Berwood and his team have been working with the United Way and with other organizations for a number of years, helping us to think about the community, helping us with data, helping us to analyze, helping us to understand the information that comes our way. So Berwood, thank you for all the help that you provide to us and support, and the stage is yours.
Thank you. Very kind. Thank you very much. Let me get organized here. That was quite an inspiring video. I suppose the organizers probably thought it would help keep you awake during the data presentation. And that's what I'm here to talk about. My team serves as the external evaluator for the United Way's Collective Impact Initiative. And our primary role is really to help the United Way understand how the collective impact work is affecting the organizations involved and the community that it serves. And I'm here today to talk about the results that have emerged from our latest round, the first 4 years of the Collective Impact Initiative. And I hope this is what I'm supposed to use. If you look carefully at our reporting, I think you'll see that first, the conditions necessary to support collective impact have been well established in Lancaster County, although some of those elements need to be reinforced in the coming year. Second, the evaluation shows that the Collective Impact Initiative has already created systemic change that will likely lead to permanent change in how nonprofits in Lancaster County think about and do their work. Third, the evaluation suggests the work of individual partnerships are improving the lives of the people they serve, and these combined efforts may indeed explain why trends in Lancaster County are better than trends in neighboring counties. And finally, I mentioned last year that the Collective Impact Initiative appeared to be reinventing the way that our community addresses significant problems. I still believe that that is undoubtedly true, but some of our findings suggest that we must start to look within our partnerships to ensure that these changes stick, while we also begin thinking beyond our partnerships about how we sustain this work and produce long-term community change. Let me provide a few details to support these points. We again rely on the evaluation framework used last year, which is adapted from a framework used to study the efficacy of collective impact initiatives across the United States. This approach uses process tracing to make links between the CI activities and specific changes these activities create among partner organizations, local service structures, local and state policy, and ultimately entire populations. The framework used in that study and in our work is shown on this slide. In the next few minutes, I'll talk about specific outcomes that provide evidence about the changes taking place within each of these bubbles. All the data I share today is available in our full report if you'd like to see more of the details. So let me begin by talking about how firmly the collective impact conditions have taken hold and the early changes that have resulted. That is, the yellow and green bubbles. You undoubtedly remember or have heard the 5 conditions of collective impact that really serve as the basis for all of our work. A commitment to shared measurement, the pursuit of a common agenda, the deployment of mutually reinforcing activities, continuous communications, and reliable backbone support. More recent research about creating effective collective impact initiatives adds one additional condition related to principles of practice. These principles are measured for the first time with our current cohort of collective impact organizations. Although we don't make direct comparisons in this report to the initial assessments we did when this started in 2015, we really do see that the conditions necessary for collective impact have become firmly established and really have substantially improved since that first time we conducted our assessment. Engagement in mutually reinforcing activities have improved markedly since the initial round of collective impact partnerships started and shows the largest overall positive change in this cohort from fall 2018 to spring 2019. The biggest change is a greater agreement that there are clear strategies to meet goals and objectives, but the most important fact is probably that most participants believe the environment around power and decision-making is positive. Responses related to pursuing a common agenda are positive. Most organizations believe that members of their partnerships demonstrate respect for each other, and the greatest improvement in pursuing a common agenda is that members trust one another and are willing to compromise. Almost all organizations involved in collective impact activities say their communications promote cooperation, and the best improvement in scores was agreement that members are frequently communicating informally. These are modest changes for the current cohort, but large improvements from the early days of our initiative. Now, partnerships groups are a bit concerned about some of the adequacy of financial and in-kind support available from the United Way relative to the other backbone supports they receive. While most partnerships believe the United Way establishes shared measurement practices for their partnerships, there's been a bit of a decline in those expressing that particular sentiment. Finally, our assessment shows that 9 in 10 organizations believe they are engaged with every principle of practice. They are focused on creating systemic change, and they are thinking about barriers related to race and class as they plan their work, although the lowest scores are probably for cross-sector partnerships. The changes we see to the 5 conditions for collective impact success, as well as the partnership's engagement with the principles of practice that encourage equity and engage community members and cross-sector partners, I think qualify undoubtedly as essential early changes. Now, in addition to the early changes, we can also see systems changes taking place. One way of seeing if systems changes are happening is by tracking how our partnerships are connected to each other. Now, this is always one of those slides that everybody likes. I kind of feel like an 80s band doing my big hit at the end of the show. But this is an important feature because analysis of network connections, as shown on this slide, reveals how the connectivity of community organizations within this initiative changed during the first 3 years of our work. The organizational interconnections we've been tracking are the really essential glue in the kind of decentralized network like we've created through this initiative. Networks bring people together to find common cause, and it is important to know if deliberate efforts to weave network members' ties for each other and to each other are resulting in efficient and effective pathways for shared learning and action. The United Way Collective Impact Initiative has been purposely designed to connect the resources and expertise of diverse community organizations to more effectively address community problems as identified by the 4 bold goals. So our analysis of network connections reveals that the connectivity of community organizations within this framework has improved greatly during the first 3 years and the 4th year. So when United Way began this work in 2015, which is up in the left-hand corner, there were many different network groups, as many as 22 different groups, depending on how you counted, engaged in this work. As we moved across, you can see from spring 2016, spring 2017, to spring 2018, you could see that those different communities converged into 6 different groups. So our groups became far more connected and cohesive. Our most recent analysis shows that these groups have consolidated into 4. The community detected appear to reflect a geographic and a bold goal grouping. The community with the geographic basis is represented by the red-colored area in this figure and appears to connect organizations that are working within the E-Town and Donegal areas. There are 3 groupings three groupings that reflect the work on the bold goals. The central community, represented by the green area, reflects organizations working on poverty and medical home bold goals. The purple community represents organizations working on improved educational credentials and employment, and the blue community represents organizations working on early childhood education. Now, I am interested in the emergence of geographic-based community. The hub model has been one of the notable systemic reforms produced by this initiative, but I think it's worth having a conversation about whether we'd prefer to see these community hubs fully integrated into the bold goal hubs, something we might want to think about in the coming year. Although my concern about the development of a geographic community is lessened because there are organizations within each community that are also connected to other communities. These are called bridges because they connect two different sets of communities. And bridges are important network features. They allow for efficient information sharing between communities. And the presence of these bridge organizations in each community is a systemic benefit of this collective impact initiative. In other words, it's a great way to make sure that people are connecting and communicating. I think our network analysis provides clear evidence that there's much more cohesiveness, much more communication, a lot more cooperation, and fewer silos among the health and social services providers involved in this work. Moreover, the network is full of bridging organizations that connect different communities and allow for efficient information sharing between them. But there's more to talk about than these early and systems changes. There's also evidence that we're beginning to see population-level changes too. We can see important and measurable changes taking place if we look at the work of some of the specific partnerships. So for instance, for Bold Goal 1, we see our partnerships building the capacity of our child care providers, helping young parents understand how brain development and their own actions affect learning, and providing education to improve kindergarten readiness. For Bold Goal 2, we see our partnerships guiding individuals towards new credentials and increased earnings. For Bold Goal 3, we see skill development and self-sufficiency training getting delivered to thousands of clients. And for Bold Goal 4, we see citizens in rural communities being screened for mental health issues and referred to providers for service at the same time that we see our newest residents, refugees, connected to medical homes. It's clear many citizens in our county are being touched by the collective impact partnerships, but is it enough to move us towards our bold goals? Well, this figure provides a snapshot of the progress that county-level indicators are showing in relation to targets established towards these 4 bold goals. I should note that we expect to have data for 2018 for Bold Goals 2, 3, and 4, which comes from the Census Bureau next month. But anyway, if you look at the data we have, these trends are favorable and suggest a county that is on track to reach intermediate targets. And if we look at the raw population, the raw number of people in these categories, taking account of the population change in Lancaster County, we see some really impressive changes in the 2 years between 2015 and 2017. Nearly 400 more children are kindergarten ready. Nearly 11,000 more adults have some post-secondary credential. Nearly 4,000 fewer people are living in poverty, and about 1,300 more people, more adults, had a personal health care provider. And I have one more bit of evidence that lets us know whatever is happening in Lancaster is unique. This figure plots the trend lines for the most recent 4 points of poverty data for Berks, Dauphin, Lancaster, Lehigh, and York County. Lancaster is represented by the green line. The trend line we see in Lancaster County is significantly different than the poverty trends in our neighboring counties. As you see, poverty is trending upward everywhere else but ours. The trends are similar for the other kinds of indicators we track. Now, I'm not suggesting that the collective impact initiative deserves all of the credit for these improvements, But I think there's little doubt that this collective impact initiative is at least partially responsible for these significant community changes. So this year's report confirms the meaningful progress being made by the partnership organizations in supporting the conditions needed for collective impact, encouraging ongoing systemic changes, and the intentional delivery of services that support collaboration and progress towards the bold goals. But as I noted at the beginning and at several points throughout this presentation, there are some issues we should think about as we move ahead. And before I talk about those issues, I think it's good to remind ourselves about why we've engaged in a collective impact strategy. We chose a collective impact approach because there were too many organizations working in isolation from one another, and they really were too few notable results. We've chosen collective impact because it brings people together in a structured way to achieve social and systems change. This requires every one of us to think and act differently, especially when it comes to evaluating our progress. Now, when we began this initiative and developed our first set of logic models with the partnerships, we identified a host of specific goals common to most partnerships. More than half the original partnerships wanted to see improvements to the way they worked with others, and more than a third wanted to change the way they did their own work or improve access to the programs and services they provided. So when I look at the top 5 goals from those original logic models, I see we are well on our way to meeting 3 of those 5 goals, which actually in my PowerPoint, they are green. Now they are red. I don't know how that happened, but they were supposed to be green. But we are well on our way to meeting those 5 goals. But it's also clear that we still have some progress to make on the systemic changes that so many of us want, which is part of the reason we have not realized the changes in attitudes about the people served by our initiatives, which was another top goal. They were red, they're now blue, the systemic and perception attitude changes. So what do we have to do to drive those changes? Because I really do think we met those 3 of the 5, and we're meeting them tremendously well. Well, I think the way we make progress is by making sure we reinforce the conditions needed for collective impact and can commit ourselves to the principles of practice. This means we need to think about whether and how to address the adequacy of our funding models, the adequacy of in-kind support that we can all provide, our commitment to shared measurement, including the continuous use of data to learn, adapt, and improve, the emergence of geographic versus bold goal networks, and the recruitment of more cross-sector partners. These all strike me as things that we need to think about to move ourselves forward. In the coming year, I'd like to see us focus first on some internal matters. That is, how we work together within our collective impact partnerships. I would like the United Way to emphasize convening and connecting, to listen deeply to partners, to recognize and leverage our partners' expertise and experience within the systems in which they operate, to help partners better learn from their data, and to identify and develop tools that encourage systems change. I would like the partners to focus on fortifying the conditions of collective impact within their own networks, recommitting to measurement, and building more partnerships. I hope these internal changes lead us to improve our communications. Improving our communications is vital to sharing our triumphs. It is vital to eliminating the charity mindset that is often the focus of such communications, and it is vital for building a network that ultimately advocates for systems change. Ultimately, I think these steps will lead us to the external systems changes we seek. So let's talk about one of those steps specifically. One that we can, that is my team and I, will dedicate ourselves to helping you with in the coming year. That is helping you learn from your data. When we started this initiative in 2014, we explained that the process of evaluating this work would be different than what is normal. Traditional evaluation proceeds by planning, acting, and then evaluating. In our work, those three things have to happen at the same time. Initiatives that are innovative, like the Collective Impact Initiative, are often in a state of continuous development and adaptation, and they frequently unfold in changing and unpredictable ways. This intentional effort to innovate is a kind of organizational exploration. In this work, there's a lot of things in flux. The framing of the issue can change. How the problem is conceptualized evolves, and various approaches are likely to be tested. Adaptations are largely driven by new learning and by changes in participants, partners, and context. Instead of the logical steps that you would see in a traditional evaluation, the experience of innovating often rapidly moves back and forth between problem and solution. A solution may initially appear ideal, but does not get at what was intended. So the problem needs to be re-examined in light of what was learned in that experience. Or a solution may be crafted that excludes a critical stakeholder, and the definition needs to be reworked so that they and their contributions to the solution can be included. The thing that we must all remember is that evaluation is a learning process that must be continuous to be useful. So, I'd like each of you to ask yourself these three questions about your own work. What, so what, and now what? The what tells us what we should measure. The so what asks us to stay in touch with our data, and the now what asks us to think about what we do next. If we begin the next year thinking in these terms, we'll have more and even better stories to tell when we gather again next fall. Thanks.